Hello and welcome to the Bigg Elimination Tribute Project, Module 7 for the Building Provider Capacity for HCV Prevention Program Integration. Module 7 is about wellness and support. My name is Jill Wolf. I am the Hepatitis C Program Director with the Caring Ambassadors Program. This training was co-created with the Chicago Recovery Alliance, also known as CRA, and it has been adapted from a training we collaborated on in October of 2019. The adaptation is made for a self-paced online module-based training. We are grateful to our sponsors for their support of the project. As the name of the program indicates, this project is in honor of Dan Bigg, the former executive director of the Chicago Recovery Alliance. Dan was instrumental in setting up syringe service program access and naloxone distribution. He was a fierce hepatitis C elimination advocate, known as the godfather of naloxone, was a great friend of the Caring Ambassadors, and we miss him dearly. It's with his spirit that we have developed this training. The overall project goal is to build the capacity, confidence, and knowledge to integrate responsive hepatitis C screening, testing, linkage to care and cure and support programs into your existing infrastructures. This program has been divided up into 7 modules. Right now, we will be covering Module 7, Wellness and Support. Each of these has been designed to be a standalone training and education session. I highly encourage you to be sure and review them if you haven't already. The Wellness and Support module is here to identify key program support structures that promote wellness and prevent reinfection and support patients who have advanced liver disease. As with, by the time this module is over, you will be able to leverage existing community supports and promote ongoing patient wellness and program sustainability. And you'll be able to identify opportunities to engage activated patients and advocate for opportunities for hepatitis C microelimination. As with all of our modules, we tee these up with listening to words of wisdom from those most impacted with the spirit of nothing about us without us. We'll start with Juanita.
Juanita, what does recovery look like for you?
Recovery will be me never doing drugs again and not even taking the methadone. You know, I just don't like to be dependent on it. You like to bounce on getting the medicine.
And so let me ask you, do you know how Hep C is transmitted?
Sexually?
Do you know what body fluid transmits it?
The semen, isn't it?
No, only one, and it's blood.
The blood, only the blood.
Blood is the only way that you would transmit Hep C to someone. So
this is vital, especially as we talk about training and wellness and education for those who are starting treatment. Juanita is someone who has been treated and luckily cured. And so this would have been vital information for her.
Really address the family. I felt addiction as a lonely disease. Being the mother of someone who is using is a very lonely disease. You're shunned from your family. You're shunned in your community. You walk outside of your house and your neighbors go in. It's sad and it's lonely. And you know what? When I was being treated for cancer, I did not shop, cook, or clean for a year. The whole community pitched in and took over. Where was my fucking casserole when my kid was dying?
So thank you. All three of these segments bring up really important points and so much to how we address our challenge of addressing substance use in our country. And you can certainly hear from Juanita and some of the different snippets through the various modules, how some of this stigma and misperceptions around people who use drugs, that she has certainly internalized them. and certainly speaks to that a bit. So let's talk about wellness and support for people who have Hep C and have been cured. And because we know that this is a cascade, that someone will fall off the cascade, and we don't want them to get back on. And it's not a continuum of care, but there is ongoing education and wellness that we can provide. And it looks different for people who started treatment and were cured at earlier stages of fibrosis, which would be F0 to F2, than those who were treated at later stages of fibrosis or advanced fibrosis of F3 or F4, which we consider those to be cirrhosis. And so for those non-cirrhotic patients who started treatment at F0 and F2, once they are cured, ultimately we give them a big hug or a high five and we say, bye, you are good to go. We love you so much, we don't want to see you here again. And we hopefully will help educate them on how to never get reinfected again. And it's important to speak with our clients about how transmission occurs. Juanita was a really great example of someone who missed out on the opportunity of hearing that sharing snorting straws would be a good way to transmit hepatitis C. And that is true. And as you saw from her surprise, she didn't know how Hep C was transmitted, and it would have been helpful for her to have learned not to share snorting straws. And so we help them learn how to not get reinfected. But we do talk a little bit about retesting and what is needed for retesting. It is really important that you talk to all of your clients who have Hep C and have been treated and cured, that they will always, their screening for antibody tests will always remain positive because they've been exposed. And I've had stories where I've had clients who have been cured and they just wanted to make sure that they were really cured. And so when they were at a community health fair, they thought to themselves, you know what, let's just get a test and make sure I really don't have this thing. But as you know, the rapid test, the rapid screening screens for antibodies, and that will always be positive on someone. So for someone who does need retesting, we would encourage them and educate them to ask for a viral load or the PCR or the confirmatory test, because we know they will always be positive for antibodies. In terms of retesting, it is about, we say about anywhere from 12 to 24 weeks, and probably closer on the 24-week, 6-month window from the time of potential infection or reinfection to when you'll actually be able to pick up antibodies, but in this case, this person would have antibodies already, but to determine if there's a chronic and active chronic infection. And so we say about a 6-month window from the time that they were to be potentially reinfected to when they would need the test. And so that's something that you'd encourage someone with ongoing risk to get tested then every 6 months or so. So we talked about for patients who have cirrhosis and who were treated at the time of cirrhosis, and that is F3 or F4, we have to remember that cirrhosis is an additional disease that was caused by the hepatitis C. And so while we've eliminated the Hep C, we did not eliminate the cirrhosis. And this person actually would then be on a continuum of care because they would need ongoing management and scan their liver every 6 months for the rest of their life to ensure that they are not developing liver cancer. So think about the cost savings of treating someone and curing someone at earlier stages of disease so that when we cure them, there is no ongoing monitoring of cirrhosis and liver cancer. And so certainly it is not cost savings to wait to treat at the time of advanced disease. So what does wellness and support look like for people who use drugs and either have Hep C or have had it in the past? And we really need to talk about this prevention of reinfection and exposure and what it is. And as we talked about in Module 1 and syndemics, this is the perfect disease where we ultimately need to leverage the funds from other disease states like HIV to help prevent hepatitis C. And so we say Hep C prevention is HIV prevention, but the reverse is not true. HIV prevention is not Hep C prevention. And there's a few key things here that I want to talk about. If you remember from Module 1, where we talked about the virulence the infectivity, if you will, in one single drop of blood, hepatitis B, C, and HIV, we saw that the likelihood that you would contract HIV was the lowest. And that is because HIV is a relatively wimpy virus, especially outside the body. It cannot live outside the body very long. And hepatitis C, while it's sort of wimpy, we can certainly kill it, it can live outside the body longer than HIV. And when we talk about prevention, it's vital that we talk about preventing hepatitis C through blood-borne pathogens. I have seen multiple times, especially within HIV, within PrEP communities, and how we're able to leverage Hep C prevention education during PrEP, starting someone on PrEP or the education along with that. There's one story that we have from our story corner I'd encourage you to check out. This was of a young trans person who was in a relationship with a guy who had Hep C, and he actually developed liver cancer and needed a transplant. And so his boyfriend was cured of Hep C and was living with HIV, and so that they could be in a relationship safely. And this young trans man got on PrEP so that they would remain discordant. And what they did not educate this couple on when they were getting them ready for PrEP was how hepatitis C could be transmitted. And so while this couple certainly had really great means to prevent HIV transmission between the two of them, they did not get great education on how to prevent Hep C between the two of them. And so the boyfriend, who had the active infection, got on PrEP and remained HIV negative, but unfortunately did transmit hepatitis C to his boyfriend, who, as I mentioned, had advanced disease and actually had a liver transplant. And so here was a case of someone who was transplanted and cured, but actually got reinfected and needed to get medication again. It's a huge example, especially missed opportunities within PrEP to provide Hep C prevention messages. It's vital that we talk about harm reduction and not just using your own needles, but using your own works and all of the table coverings. These are all, I would say, radical non-sharing is certainly a really great way to say how to approach this, but harm reduction strategies are vital with Hep C. We've seen in some studies that hepatitis C can live inside the barrel of a syringe for up to 63 days. And so in certain conditions, hepatitis C can really wreak havoc outside the body, especially if you come into contact with it in your body, especially from drug use and behaviors. There's an ample opportunity to come into contact. And as we talked a little bit earlier, we talked about testing frequency. For someone who is engaged in harm reduction strategies for their drug use, hopefully they will not have any exposure, but if they are at all exposed, we want to make sure that retesting does happen, I would say at least yearly at a minimum, if not every 6 months, to be sure to find out if there's chronic infection. Additional wellness and support, especially for those who are cured, is we want to talk about household transmission. Hepatitis C is not as easy to transmit through household exposure as hepatitis B is, but certainly there is a way to expose, and this is where we would tell folks not to share razors or clippers or tweezers, nail clippers, or anything that might have microscopic blood on it. We do certainly encourage you to educate on sexual transmission, and studies show that sex is actually a really poor way to transmit hepatitis C. And there are studies of non-discordant couples, discordant couples. One partner has hepatitis C and the other doesn't, and they've had unprotected sex for years and have not transmitted hepatitis C to each other, which speaks to the fact that sex is a poor way to transmit hepatitis C, but it certainly doesn't mean that there's no risk. There are certain subgroups, especially where the presence of blood is there, where those subgroups are certainly at increased risk of developing or transmitting hepatitis C through sex. want to make sure that we talk to those who have Hep C about vaccination and ensure that they are able to get access to and complete the scheduling three doses for the hepatitis A and B to help prevent them from any further liver insults. And we certainly want to help talk about risk reduction and harm reduction as it relates to liver health in general and drug use. And one thing that's important to think about within liver disease is even more so than hepatitis C is hurting our constituents, fatty liver disease is certainly something that's way more on the rise and something that should definitely be looked at. So general liver health is something that we would want to promote with someone who has cured hepatitis C, and that's not only reducing reinfection, but certainly discussing how toxins and alcohol, etc., and certain medications can be toxic to the liver in general. And of course, discussing drug use on how to use safely if they are going to use, and opportunities to minimize any transmission. So as one thing that Dr. Aronson talked about in the cure slide as some of the things that changed are the ways in which the rules around access to drugs have loosened. And it has been because of advocacy and people stepping up and speaking out that has helped this to happen, that these rules across the country have been loosened. And using HIV, and we have Peter talk a bit about what we, in a few earlier modules, what we can learn from the HIV community. Huge thing we can learn from the HIV community is that when you speak up and you speak out, things can and will change. And so I want to point out this picture over here is of a gentleman, Larry Holmes. I saw this on the cover of the Chicago Tribune and was really interested in this gentleman's story, who was a Medicaid recipient and was denied access to cure because he wasn't sick enough. And he came forward and spoke out, and as I'm sure you can imagine, because he did that, he did get access to cure. But ultimately, it's guys like Larry who need to come forward, and it's him coming forward that has paved the way for so many others. And so certainly there is stigma at play for many folks, either through drug use or just around having hepatitis C. And it's being able to hold space for those and provide opportunities for them to share these stories and educate others on hepatitis C and their experience. Really great opportunities as well for those who have been cured to be peer educators and helping others learn from their experience, and just general education around hepatitis C. And these are great opportunities for you to also share some of these snippets and stories with your elected officials to influence the way that your state Medicaid handles hepatitis C, and certainly providing access within your communities. So with that, we have a project that we work on, ongoing project, and we call this our Story Corner. This is just a snapshot of a little image of that webpage, and we've collected stories from people who are directly impacted by hepatitis C. Here's that picture of Larry, of the gentleman that I just showed in the earlier slide. And I encourage you to listen to what these folks have to say. We've got people from federal government like Karina Dan, and we've got folks all over the country who have shared in their story and in a way to eliminate stigma and certainly help folks with access to medication and hepatitis C elimination. So I would be remiss if I didn't speak a bit about the Chicago Recovery Alliance and the work that they do with naloxone training. This is available on their website, and there are other naloxone videos for training as well, but I would like to share this one, and we'll get to hear actually Dan's voice in this too. So sit back and listen to this.
The Chicago Recovery Alliance is about assisting any positive change as a person defines it for him or herself. The Chicago Recovery Alliance offers naloxone and education about intervening successfully in opiate-related overdoses.
Now, there's all sorts of lore about what you do for overdoses. to get people up and walk them around, to put ice on their genitals, to inject salt water, to stand them in a cold shower. And certainly any of those will work to help stimulate the nervous system and may help bring them around. But there is a very specific, very safe, totally effective antidote to heroin overdose.
Naloxone.
The name of it is naloxone, or Narcan, which is the brand name. It's available now in generic.
Naloxone.
It's been used in emergency rooms and by EMTs and paramedics for 30, 40 years.
He's not dead, it's a heroin overdose. Let's break out the Narcan.
Naloxone.
An incredibly safe, incredibly specific treatment that specifically reverses the heroin overdose.
Naloxone.
A heroin overdose kills by going to a specific place in the brain, the place in the brain that tells you to keep breathing. And it turns that place off, so you stop breathing. A couple of minutes without someone breathing can cause irreversible brain damage. So it's really important that it be intervened on immediately.
Naloxone.
This medication specifically kicks the heroin out of the brain so that that overdose effect goes away.
Naloxone.
It's one of the only treatments in medicine that literally can't hurt anyone. The worst that's going to happen when someone's given naloxone is that they'll get dope sick.
Check the expiration date. Keep naloxone in muscle syringes around whenever you're injecting. Store naloxone at room temperature and keep it away from the light. Light deactivates naloxone. Get your naloxone vial replaced after each use. Only use a new syringe to go into the naloxone vial. Always use with other people. You protect them, they protect you.
When a person be ODing, they have them turn different colors, like dark blue or dark purple, like, and their lips turn their color. Their eyes go into the back of their head, and their white stuff come out their mouth. And they start shivering all over.
She OD'd. I mean, she just went out, and it was like the lips were turning blue. She wasn't breathing. She was going. Her eyes were fluttering. She was just going in and out, and I could tell.
You know that they're gone or they're leaving.
And next minute, you're waking up and you're a little bit disoriented of what's going on around you.
I was scared. I didn't know what was really going on, but I knew they were dying.
I remember saying, Dennis is good.
Shit. What do you think, Steven? Steven?
That's for stimulation. The first thing you want to do is figure, is this person overdosed or is this just a good high?
Steven?
You talk to somebody. If they don't respond, the test physical
fucking great.
If you're opiate dependent, stopping your using for even a few days increases your risk of overdose. Mixing alcohol and or cocaine or pills with heroin increases your chances of overdose.
Steven.
Knuckles against the sternum or in the upper lip and just rub them.
Is he breathing?
God damn, no, his lips are all blue.
C for
Should
call
I
for
call the
help.
ambulance?
Yeah, call an ambulance.
The thing that kills people in heroin overdose is not breathing.
A is for airway. You need to make sure there's nothing obstructing someone's airway. R is for rescue breathing. Rescue breathing involves tilting the head back,
Pinch off their nose, seal your mouth over theirs.
breathing twice,
I don't know.
and then once every 5 seconds for someone watching their chest and abdomen rise. E is an evaluation step. Can you keep this up indefinitely?
Okay,
How is the person doing? Is their color getting better? Are you breathing for them successfully?
M is for muscle.
Should I get a shot of naloxone?
Yeah.
1 cc intramuscular injection of naloxone.
You take the needle and you stick it into the bottle and you draw up 1 cc.
Each of these syringes have 1 cc in them. These 2 syringes are half cc, so you would have to inject 2 of these in order to get 1 cc. 100 units in an insulin syringe equals 1 cc. Problem with these syringes is that the points are too small. If you have to use these syringes to inject naloxone, you should inject it into the tongue. But the best syringes to use are these. Points are all 1 inch or more, which is easy to get into a muscle.
In the shoulder, in the thigh, or in the booty.
1 cc just goes to the 1 on each of the syringes.
Don't spend your time fumbling for a vein. The seconds count here.
You can just do it through his shirt.
Okay.
Continue the rescue breathing, and then there's another period of evaluation. It takes 3 to 5 minutes for naloxone to start working. If they aren't awake and alert, they may need to get an additional shot. We suggest that after 2 1 cc intramuscular shots of naloxone, and 5 minutes after each shot, and the person is not awake based on that, that it is not an opiate overdose, and just continue the breathing and wait for the ambulance.
I think we can do another shot.
What the fuck?
When their friend comes around, they're going to be feeling sober. They may want to use to get that sober, slightly sick feeling off.
Are you okay? Where's my shit?
It's important that they be prevented, be talked out of doing that, because that's going to just compound the overdose.
Fuck, you fell out, man. We had to give you naloxone, you shithead.
You're blue.
When the naloxone wears off in 30 to 60 minutes, even if they haven't used again, the overdose could come back.
Naloxone kicks opiates out of the brain for around an hour. Heroin lasts 6 to 8 hours. Heroin outlasts naloxone. Methadone lasts 24 hours. Methadone far outlasts naloxone. The overdose can return after naloxone wears off.
Shoot him again.
All right, so we gotta like hang out with you now for a couple hours, cause you're still on it, and you'll get high again, but you could fall out again real easily. So like we gotta watch you now.
Definitely appreciate CRA doing this and giving us some very brief, and I encourage you to engage with face-to-face naloxone training if you haven't done so already. So in terms of wellness and support, as we look at what's changed, we know that in terms of the Hep C treatment, that successful treatments work for everyone. And that integration of resources are needed to support the ongoing monitoring of people who have Hep C, either risk for infection or are at risk for liver complications because of their advanced disease. Additionally, and what I haven't listed on here, but that's changed, is access to naloxone and harm reduction services. I know that around the country, this is something that is certainly taking off, and there are certainly other places in the country that are having way more pushback, but this is definitely something that has increased access for folks. As we wind up here, I want to encourage you to take a look at some tools that we've provided. Certainly our website at the Caring Ambassadors, we have loads of hepatitis C specific information. I want to encourage you to check out that discussion point. And we'll provide a link to that, and also some of our educational resources, which they're free, so you can put them into your cart and we'll send them to you for free, so you can have visual representation of Hep C in your waiting rooms and within your community centers. I want to encourage you to look at Chicago Recovery Alliance and some of their training and education resources. Of course, they have their outreach locations, which may not benefit those of you who are not in Chicago proper, but certainly will give you an opportunity to see how they set things up. I want to encourage you to look at Live for Lolly. Laura and Alex, who were some of our speakers, they work at Live for Lolly, and Live for Lolly was trained by Chicago Recovery Alliance. So they also have really great resources and educational resources available to you. And certainly want to encourage you to look at the Mental Health America of the North Shore is one segment. They have other locations as well throughout the country, but certainly in these times of COVID and isolation, I highly encourage you to look at MHA, Mental Health America, for their resources, and certainly thanking them for provision of CEs for Illinois social workers and counselors. So in conclusion, our hope is that you will be able to implement these tools offered through these 7 modules. We'd love for you to share these webinars with your colleagues, especially to get some program momentum going towards microelimination in your individual systems. And of course, we're hoping that you cure your patients. We'd love for you to give us some feedback on your thoughts on the program overall. You can certainly email us any information, feedback, thoughts that you might have about this training. We want to encourage you to take the pre and post-test surveys. We'll step you through if you want certificates and how many hours you'd be requesting. And of course, please access the tools and the resources that we put on each module page to help you eliminate hepatitis C in your communities. So in honor of Dan Bigg and all the work that he has done for any positive change, and in honor of those with Hep C, and certainly in recognition of National Hepatitis Awareness Month, we thank you for getting through these modules and doing what you can do to eliminate hepatitis C from our blood supply. Thank you.